This podcast does not provide medical advice. Please listen to the complete disclosure at the end of the recording.
Hello, everyone, and welcome to Everyone Dies, the podcast. I'm Marianne Matzo.
And I'm having a drink. I'm Charlie Navarrete.
You know, it's early in the morning. No, not so early.
It's not early in the morning. It's happy hour time, actually.
And it is November the 7th.
Yes, it is.
And where were you when you heard the news?
When I heard, clapping and elation and people yelling, "Yay!" Actually, I was sitting quietly reading a book, and I didn't understand why all that was. And then I started getting tweets and WhatsApp notices and texts, and suddenly the word "he won." I think, oh, okay, so we have now a new president-elect, and it's funny. The second thing that came to my mind was, this is the second Catholic president we have elected. John Kennedy, of course, being the first. So there we are.
And this is Biden's just his second wife, right?
Yes. His first
wife died.
And was it their daughter? Or
yes.
It was
I just heard that story this morning, and I knew that Biden had a wife and daughter that were killed in a car accident, but I never kind of heard the whole story. And so what I heard was that he was only 29 years old, had just been elected,
right.
And it was right before Christmas, and his wife and daughter were killed in a car accident, and the two boys were hurt. And I guess he had said to President Kennedy, "I'm not going to take the nomination. I'm not going to come to Washington and get sworn in." And Kennedy convinced him that, it would be better for the country and better for him in terms of his healing and his grief to come. And so Biden made the decision. He was sworn in, but every night he went home, took the train home, and I've always heard those stories about him taking the train home. I never knew kind of the context of it. Took the train home to be able to read a story to his kids, to his boys before bed,
right,
and to be there when they got up in the morning. And that was part, apparently, of his healing and his grief,
right,
and his commitment to his family was to take care of those two boys. And I never heard that full story before. That's a lot for someone to take on, man or woman.
It is. And then, of course, in moving forward, I mean, he had his own, brush with death with that aneurysm, and what was it? They took it out like at the last minute. They were, I don't remember the entire story, but basically they took it out at the last minute before it exploded. And he said goodbye to his sons, to his new wife. Just said goodbye. Didn't really expect to come out of this alive. And then, of course, his son was. His son died. Was it 2 years ago? He also had was it brain cancer he had? It was also something in his brain. I don't remember what.
And I remember seeing an interview that Biden did like right after that with was it Stephen Colbert? I want to say it was like right when Stephen
Colbert just started.
Just started, was one of his first interviews was with Biden, and it was so empathetic, and like to be a parent and have to bury one child is one thing,
but geez,
to bury two children is like, the trial of Job is like, geez, leave me alone. you know. But he's kept his, at least in the public face that I see, is that he's kept his humanity and his kindness and his gentleness,
and he's also kept his faith. Never,
That has to be hard, right?
Yeah, when you said Job, it reminded me of that. He's always kept his faith. Bless you.
Excuse me. Speaking of the faith.
All right.
Do you know why you say God bless you when somebody sneezes?
Oh, something about keeping the evil spirits away. Was that it?
My understanding is that it was thought that you die for a second when you sneeze.
Okay.
And you come back and it's like, God bless you, so that, and maybe it's to keep so no evil spirits get in when you're dead for a second. I don't know.
So what would an agnostic or an atheist say if someone were to sneeze around him or her?
Cover your mouth, damn it!
I would think something like that. Yeah. Don't sneeze on me. The old thing. Don't tread on me. Don't sneeze on me. Yes, exactly.
Don't step on my blue suede shoes.
Yes, exactly. Yes.
So put up your feet and relax, and thank you for spending the next hour.
I love your segues. Very smooth. Very very nice. Very nice. So what are we going to talk about?
As Charlie and I talk about our class assignment, Cocoa, which we've already talked about.
With little marshmallows on it.
We already talked about once last week on the recording that disappeared into the ethers. We have no idea where it went.
The ethers.
So hopefully whatever we said last week will be as interesting this week. In the second half, I'm going to talk about Huntington's disease. And in our third half, Charlie's going to read a blog entry from Reaching Out in Love. So, Charles, we had a class assignment for our group.
Yes, we did.
For our listeners. We asked them to do...
and the dog ate my assignment, so I'm sorry. The dog ate my video. Sorry, so I couldn't finish the assignment. Yes.
So I watched Coco. I had never seen it before.
Oh.
And I really loved Coco, the old woman. I just thought she was just a sweet thing. And I loved I really like the concept of people that we have a day or 2 days where the people who have died can come back and see us, that we can pull out their pictures and build an ofrenda and make their favorite foods and light the candles and light the incense and then say, oh, it's midnight. And actually, I've never built an ofrenda before, Charlie, so I built one this year. Pulled out pictures, found pictures.
And if I may interrupt in case a couple of you folks didn't hear our episode a couple of episodes ago, basically, during the celebration.
Listen to it, for God's sake.
Well, yes, there's that too. Let's start with that. Listen to it. So during the holiday of the Day of the Dead, what Marianne is speaking about, an ofrenda is basically an altar.
Right.
But you don't have to think of it as just a slab of marble. If you have usually there are tiers, so maybe you have
it could be a slab of cheese.
There you are. It'd be a slab of cheese on top of each other. If you have a couple of footstools, and then on top of that a wine crate, and then on top of that a shoebox.
I used the Kleenex box.
Did you? All right.
I did. As part of my,
yes, the level, the step thing, and generally
it has to have levels.
Yeah, and generally at the top, not generally, but at the top are pictures of your loved ones who are deceased, and then in the middle usually there's food, a little cheese, a little wine. Okay, that's me thinking, but usually
whatever the person who's died,
that's it. What they liked, yes.
Yeah.
So
White Castles and pizza for Charlie, and martinis.
Yes.
White Castles and chocolate for me.
A new definition of a good death. There we are.
Oh God, yeah.
Yes.
Just waft those White Castles under my nose as I'm going. And I'll know I'm on my way to heaven, baby.
And I still can't believe that there are no White Castle restaurants and I use restaurants, not in a very loose term, in Oklahoma.
I think somebody should start a petition with White Castle. Did I hear that White Castle, like, this is their 100th year or something?
Yes.
Did you tell me that? Is it really 100 years?
Oh, pooh, I forgot to look it up.
I bet you some of those onions on the grill are 100 years old. What do you want to bet?
No, I would leave it to about a quarter of a century. I think 100 is just way too long. But that's the thing, though.
That's what gives the flavor.
That's it. And though they're grilled, obviously, on metal, yeah, that metal just somehow magically absorbs that great onion flavor. Yes.
Yeah.
Yes.
But we digress. So the ofrenda that I built, I can post a picture if you guys want to see it. I thought it came out pretty good. My niece, as it so happened, the week before, my sister had died when, 18 years ago? And my sister's husband has apparently not allowed her daughters or anybody to take anything out of the house, and it was a big house. Oh. And so he recently sold it.
Okay.
And said to the girls, okay, we got to clean this now. But he really kind of didn't, according to my niece, didn't really want to let anything go. And so she had kind of taken a box and put stuff that she thought that I would like. And it was really interesting that two of the things that were in the box were things that I'd given to my sister from when I'd gone to teach in Russia. And I said to Anna, how did you know that, like, these were things I gave to Joan? And she said, I didn't know that. She said, I just knew that they were things that, my sister really had liked and used a lot. So she thought that I would like them. And I thought, man, that's pretty bizarre that out of the, 8 things that she put in the box, 2 were things that I'd given her.
And including, what I find interesting is Russia, because as we record this, it has been several days since Sean Connery, the first, and again, technically he wasn't the first, but in the movies, the first 007. And what was the name of Sean Connery's first outing as James Bond, that movie?
Let's Go Have Martinis?
No. Though it could have been that. To Russia with Love.
Oh.
You see the connection?
You know what I saw? Yeah, I do.
Yeah.
You know what I saw? And I never knew this. And I almost shared it on Facebook, but then I thought people would think I was being creepy.
Goldfinger.
Did you know that... No.
No?
Did you know that Sean Connery was a bodybuilder?
Oh, yeah.
Well, I didn't know that. So there's this picture of him in this, like, bikini-ish thing.
Yes. Mm-hmm.
I think he came in, like, 2nd or 3rd.
Yeah.
And he was pretty young because he was, that younger, thinner body. But let me tell you, a nice, younger, thinner body. I've always had a crush on Sean Connery. I don't know what to tell you.
Yeah, a friend of mine... said, did you hear Sean Connery had died? And she said, as you just did, that, she always had a crush on him. And I wrote back to her, I remember someone once reading somewhere that someone had said, women always wanted to be loved by him, and men always wanted to be him.
Oh, I could take it a step further. He could love me and love me. You know what I'm saying?
Mm-hmm, mm-hmm. I see. Yeah. and then
so
also,
anyway.
Well, also with Goldfinger. now we're talking about death. So Mr. Connery, or Sir Sean, just died. Of course, Honor Blackman, who played Pussy Galore in the movie, died in the spring.
Oh.
And I forgot the actress's name. The actress who was painted all gold in the bed. I don't remember. No, not her. Sorry. In the beginning of the film, when Shirley Bassey is singing Goldfinger, there are hands in the opening credit, all in gold. That was a hand model. And she also had a bit part in the movie, and I don't remember her name. But she also died about a month and a half ago. Hi.
So, back to my ofrenda.
Oh, yeah, sorry. Okay.
So my niece sent me this box of stuff.
Yes, about Russia.
So I used the scarf as the base of my ofrenda, and then I found pictures of my sisters and my grandparents and my grandma. I love this. I have this one picture of my grandma with her two daughters. One is my mom and one obviously is my aunt, but my aunt is like really young in bobby socks, like white
Oh,
anklets. So
okay.
she's really young. And my grandma has this great smile on her face, and both of the sisters look, kind of happy. And it's just this really sweet picture. So I put that up, and I didn't have a picture of my dad. The only picture I had of my dad was with me, like maybe one or two, sitting on his lap. And I thought, well, I'm not cutting myself out of that picture because I really like it.
Yeah.
And I was too lazy to like copy it. So I just went in. I said, Dad, I know, sorry. Listen, you're just going to have to walk over to the Ofrenda and visit
Yeah.
because I'm just too darn lazy to do this the right way. So you're staying where you are. Um, Maybe by next year I'll be more organized. And then I put out this really good raisin and apple cake that I made. And David put out like a shot of, I don't know what, for everybody to drink. And then at midnight, we lit the candle and we kind of hung around and chatted with everybody. And then David had put up a picture of his wife who died, 3 years ago. And I'd said to him, I said, well, if you need to just hang out and spend some time with Stacia, just do that. And I tootled off to bed and, but then we kept the candles lit for the 2 days. And
it's nice.
it was nice. I'd never done that before.
Right.
But I did it because of, watching Coco. And I didn't want anybody to get stuck on the other side because we'd forgotten them. Although maybe my dad is stuck on the other side because I didn't put the picture on the Ofrenda. But, there's my Catholic guilt speaking again.
Right. One more reason to burn in hell. Yes.
I know. God knows I don't have enough. So what were your thoughts about Coco? Anything? Did you build an Ofrenda?
No. But I know how to spell it. So I feel that's a step in that direction.
Maybe next year you'll build one.
Yeah, I didn't. I knew of them. I know about the holiday, but it just never. I don't know. I never celebrated it, but yeah, maybe next year I will. Yeah.
I think as the older we get and the more people we love die, we have maybe more reason to want to have a conscious period of time where we're saying, I'm unpacking my grief and I'm just visiting people and addressing it as opposed to try to deal with it every other day. Does that make any sense?
Well, it almost sounds as if you're suggesting that you can deal with it for a day and then the other 364, it's all right. I'll think about it again next year.
No. I'm not saying that at all. What I'm saying is that on those 2 days, the Day of the Dead, All Saints Day and All Souls Day, there's that, let me get the pictures and really look at them. Let me think about what they'd like to eat.
Yeah.
Let me just sort of be very mindful that they're not here anymore. The rest of the year, you kind of deal with it, but you don't necessarily, I don't want to say wallow in it because that's not right.
No. That's not the right word. No.
But you're not immersing yourself or letting yourself, like we've had people die, but how often do you just sit and look at their picture and really think?
Yeah, that's it. Right. Have that moment, stop thinking about the world going around, the world around you. And that's it. Just focus 30 seconds, a minute. Yes. Maybe longer, and you get lost in your thoughts. Yeah. I'm sorry, what?
Or every time you go by the Ofrenda, you're like, hey, guys, like I talked to them the whole 2 days they were there,
Yeah.
But I don't keep those pictures like they were like right there on my sideboard. I went by them a lot and chatted for the whole 2 days. I don't normally do that.
No. When I say about family, it's just, I can't think the right sentence, but it was, I mean, the idea that family comes first, and that oh, gee, I forgot his name. Manuel, right? Is that the protagonist, the little boy?
I don't
I don't
remember
remember
now.
either.
That was a whole week
I
ago,
know. Oh my
Charlie.
God. Well, see, for me, it was longer. It was like 10 days ago. So, yeah. So we can understand why I don't remember. Well, for now, let's just call him Manuel. Um, that through it, by the end, it was about family, but he was able to include his needs, if you will. He also has wishes. He also had, dreams, and which were always poo-pooed and actually frowned upon. But in the end, everything just comes together, and he's able to have his own, life as well. His own aspirations. And the other about what was the thing on the nightclub? Grab.
Seize the Day.
Seize the Day.
It was,
yes. Yeah.
It was that take on Carpe Diem.
That's it. Yeah. So but yeah, I mean, it was enjoyable. It made its points. There was one song I don't remember the title.
I laughed. I cried. Oh, Remember Me.
Yeah, I'll remember you. But what was the song?
I kept walking around that whole week singing that song.
Yeah, so it went for it. Yeah, so the song was there beginning and end, toward the end, and it kind of took on like a little different meaning, which is very nice. Yeah, so I give it a thumbs up.
Thumbs up. I give it a thumbs up.
Okay.
So we agree.
Very good.
Yeah.
Yes. So please go to everyonedies.org. That's dies.org. And though we didn't talk about recipes today, if you have recipes, or even if you don't.
We didn't talk about them because nobody sent me anything. So.
Oh my God, no. So please.
So there.
So please, we don't want to make Marianne cry. So please send us your recipes and we'll share them with others. Also, we appreciate your questions and anything else you want to tell us. You can email us at mail@everyonedies.org. And again, the number 1. Please join.
It's mail, M-A-I-L, not M-A-L-E.
Ooh.
I don't want you to think you're sending it to Charlie alone.
No. Yeah, so it's mail, M-A-I-L, at dies.org. Please join our Facebook group, Everyone Dies, and please remember to rate and review this podcast. Molly, our infamously fabulous Twitter diva, is hoping you contribute to her job security by following us on our Twitter and reposting her tweets. Keep her employed.
Yeah. So in our second half, we're going to talk about Huntington's disease.
Oh.
And it's an interesting disease, objectively, but a very difficult disease to get. Huntington's disease is a rare inherited disease that causes the progressive breakdown or degeneration of nerve cells in the brain. Huntington's disease has a broad impact on a person's functional abilities and usually results in movement, thinking, and psychiatric disorders. Now, back when I was starting out as a nurse, it was always called Huntington's chorea. And the chorea was that movement, sort of a snake-like movement that people would have. And way back, it was really had, people thought people were possessed because
right. Yeah, I remember that.
It was kind of that look like, like Reagan in, what was the movie? Reagan, the...
Ronald Reagan?
No, Reagan, the kid in that movie. when we were in high school.
The Exorcist.
The Exorcist. This isn't funny. Huntington's isn't funny. We, though, are terrible people.
Yes.
Yes, in The Exorcist, when she would have that movement and that kind of thing.
But was her name Regan or...
I thought it was Reagan. I don't know. All right. So
Well,
that
fine.
was 1975. Do you know how long ago that was? It was 73, whatever.
God, I hate
But
math.
anyway, that's that kind of movement. And
Hmm.
so it was when I learned about it in nursing school, it was Huntington's chorea was what it was always called. But it's since been sort of renamed Huntington's disease because there's a lot more to it. And they have found that the chorea part, that movement part, is a very late stage symptom. And so people can have Huntington's without getting to the chorea part. But I get ahead of myself. Symptoms will usually start between 30 and 50 years with a range of 2 to 80 years. So there is a childhood Huntington's disease.
Yeah.
Which we're not going to really go into, or we're not going to talk about at all, but just know that kids can get this. The first symptoms of Huntington's disease often include difficulty concentrating, memory lapses, depression, including low mood, a lack of interest in things, and feelings of hopelessness. Now, this disease, Charlie, was first documented in the late 1800s by a New York physician. Now, this guy lived in East Hampton, and his dad and his dad before him were physicians in that area, taking care of the same patients. And this third-generation physician was going through the records that his dad and his grandfather had kept. And in looking over these logs, he began to identify physical and psychological characteristics of the disease that would later be named for him. And the reason that he was able to see them is because it's hereditary, and I'll talk about that in a minute, but it runs through families.
Oh.
And so he was able to see these patterns that had run through families, presented a paper about it, and eventually the disease was named for him. So there's movement disorders. Movement disorders are part of Huntington's disease. They can include both involuntary movements and problems and impairments in voluntary movements. Voluntary movements are anything that you say, I want to pick up that martini, and that's a voluntary movement.
Right.
Involuntary movements.
If I pick up a vodka martini, then that's an involuntary movement instead of a gin martini.
Yeah.
Got it. Okay.
Right.
Thank you.
Okay. Involuntary movements, though, are so things like involuntary jerking or writhing movements. That's the chorea, that part of it.
Yeah.
Muscle problems such as rigidity or muscle contractures. That's called dystonia. Slow or abnormal eye movements. Impaired gait, posture, or balance. And difficulty with speaking or swallowing. Impairments in voluntary movements rather than involuntary movements may have a greater impact on the person's ability to work, perform daily activities, communicate, and remain independent. Now, the cognitive disorders, thinking disorders. Cognitive impairments often associated with Huntington's disease includes difficulty organizing, prioritizing, or focusing on tasks, lack of flexibility or the tendency to get stuck in a thought, behavior, or action. And that is called perseveration. Okay. So perseveration can be in thinking, just thinking about that one thing over and over and over again. Or you can have perseverative movements where you do the same movement over and over and over again.
Oh, okay.
Lack of impulse control that can result in outbursts, acting without thinking, and sexual promiscuity. A lack of awareness of one's own behaviors and abilities, like you don't know that you're acting like a jerk, but you're acting like a jerk. Or you think that, oh yeah, I can fly, without knowing that you really don't have the ability to fly. That's not a good example, but you get the gist of it.
Yeah.
Slowness in processing thoughts or finding the words to say what you mean, which Charlie and I have that one for sure.
Mm-hmm.
And difficulty in learning new information. So psychiatric disorders, the psychiatric parts of this disease. The most common psychiatric disorder associated with Huntington's disease is depression. This isn't simply a reaction to receiving a diagnosis of Huntington's disease. Instead, depression appears to occur because of injury to the brain and subsequent changes in brain function. Symptoms and signs that may include in Huntington's disease are feelings of irritability, sadness, or apathy, and apathy is not caring about anything.
Yeah.
Social withdrawal, insomnia is trouble sleeping, fatigue or loss of energy, or frequent thoughts of death, dying, or suicide. Other common psychiatric disorders include obsessive compulsive disorders, a condition marked by recurrent intrusive thoughts and repetitive behaviors, like needing to turn the light switch on and off 5 times when you come in a room or something like that. Mania, which can cause elevated mood, overactivity, impulsive behavior, or an inflated sense of self-esteem. Or you can see bipolar disorders, a condition with alternating episodes of depression and mania. In addition to these disorders, weight loss is common in people with Huntington's, especially as the disease progresses. So, what causes all of this? It's what's called an autosomal dominant inheritance pattern. And I gave Sandy, our producer, sort of a picture to show that. All you need is one of your parents to have this defect in one single gene. So Huntington's disease is caused by an inherited defect in one single gene.
Jeez.
Huntington's disease is an autosomal dominant disorder, which means that a person needs only one copy to develop the disorder. So, with the exception of genes of the sex chromosome, a person inherits 2 copies of every gene. 1 copy from one parent, 1 copy from the other parent. A parent with a defective gene can pass the defective copy of the gene or a healthy copy. So, each child in the family has a 50-50 chance of inheriting the gene that causes the disorder. So if Charlie, you and I got married and we had babies, God help everybody involved in that scenario. And
So true. Yes.
And you had a copy of this gene and I didn't. So if we had 4 kids, each of those kids has a 50-50 chance of getting this disease.
Yeah.
Now, that could be all 4 of the kids, because you're rolling the dice each time.
Right, yeah.
That could be 2 of those kids. That could be 3 of those kids. It's a roll of the dice. Each kid has their own 50-50 chance. So, can you prevent this disease? Well, first, Charlie, you and I are never getting married and having babies. Right. So that is the first way that we can prevent this from happening. People with a known family history of Huntington's disease are understandably concerned about whether they're going to pass the Huntington gene on to their children. So they might consider genetic testing and family planning options. Another option for couples is in vitro fertilization and pre-implantation genetic diagnosis. So in this process, eggs are removed from the ovaries, fertilized with the father's sperm in a laboratory, and then the embryos are tested for the presence of the Huntington gene. And only those testing negative for the Huntington gene are implanted in the mother's uterus, therefore, making sure that the child does not have the disease. Now, that doesn't, I don't know, I guess I'm not going to say that it doesn't keep them from passing it on, but I guess it must keep them from passing it on, because if they don't have the gene, they can't pass it on.
That makes sense, yes.
Okay, so how do you know if you have Huntington's? Adult onset is the most common type of Huntington's disease. It usually begins when people are in their 30s or 40s. Initial signs include depression, irritability, hallucinations, psychosis, minor involuntary movements, poor coordination, difficulty understanding new information, and trouble making decisions. Symptoms may occur as the disease progresses, including uncontrolled twitching movements called chorea, difficulty walking, trouble swallowing and speaking, confusion, memory loss, personality changes, speech changes, and decline in cognitive abilities, meaning ability to think.
Right.
So there is no treatment. There's no cure for Huntington's disease. There are drugs that are available that can treat the mental disease or the mental aspect of it, like antipsychotic drugs. There are some drugs that can control the movement disorders associated. There are antidepressants, mood stabilizing drugs, speech therapy, psychotherapy, physical therapy, occupational therapy. These are things that just help with what you see from the disease, but it doesn't stop the disease.
Got it.
So after Huntington's disease starts, a person's functional abilities gradually worsen over time. The rate of disease progression and duration varies. The time from disease emergence to death can be 10 to 30 years. Other numbers I saw were 15 to 20 years. So it's one of those things, it depends. I hope you guys will listen to the interview that I did with Michael, who we do a radio show on Passionate World Talk Radio called Everyone Dies. And the interview that I did with Michael, his wife has Huntington's disease. And she was, I want to say, maybe 55 or so when she was diagnosed. And her story, just a short version of her story, was that for years there were personality kinds of things, and in her case sort of would blow up and then kind of get past it pretty quickly, but was never recognized that, she had any issues until she had issues where her legs were kind of moving, and they thought maybe that was restless leg syndrome, and her hands. And she was taken and tested and went through all this stuff until finally the doctor said, the only thing I haven't tested her for was Huntington's. He said, really kind of go home and learn about Huntington's and decide if you want to be tested for this.
Wait a minute. Why wouldn't someone want to be tested for it?
Well, because it might not be something, like any kind of genetic disorder like that. You might not want to know that news. There are people who don't want to know things, Charlie. So they went home and they kind of read about it and they said, well, if it's this is not really very thrilling, but we want to know what the heck this is.
You want to know what's going on.
Said,
sure.
I want to know what it is. So they went, there's a specific genetic test for Huntington's. Sure enough, that's what it is. Well, so then how you have that, that makes sense.
Mm-hmm. Yeah.
In terms of her father, they said, geez, that explains an awful lot about Dad. And what Michael says is that he was just sort of an asshole. Excuse me, Sandy, but I'm just quoting him.
Yes.
And he went to, I want to say that was the brother. Anyway, he just kind of had this personality that people just said that he was kind of, and they said, I wonder if that's what Dad had. And then she had a brother, I think it was an older brother, who had, the assumption was that he had gone to his daughter's wedding drunk, and it was like an early morning wedding.
Mm-hmm.
And then they thought, I wonder if that's not what it was. And maybe it was Huntington's, because Huntington's can look like that. You have slurred speech and large movements. So they contacted the brother and talked to the wife, and they said, maybe you should get tested for this. Well, sure enough, the brother also had Huntington's.
Oh, wow. Okay.
And a second brother also tested positive for Huntington's. So it can run in families and people not even know this is what this is. So his interview is really interesting to listen to. And Charlie's going to read something from Michael's blog that will give you some insight into this too in our third half. So, the clinical depression associated with Huntington's disease may increase the risk of suicide. And some research suggests that the greater risk of suicide occurs before a diagnosis is made and in the middle stages of the disease when a person starts to lose their independence. Eventually, a person with Huntington's disease requires help with all activities of daily living. And activities of daily living are things like brushing your teeth, combing your hair, getting dressed, all that stuff. Late in the disease, he or she may be confined to a bed and unable to speak. Someone with Huntington's disease is generally able to understand language and has an awareness of family and friends, though some won't recognize family members. The common causes of death from Huntington's are pneumonia, which is the most common, because think about it, if you're not able to swallow kind of correctly,
right. Yeah.
you can aspirate and that'll go down into your lungs and cause a pneumonia. And that's, true in other kinds of dementias, like Alzheimer's disease, that's true too. Or other kinds of infections. Another cause of death is injuries related to falls. Complications related to the inability to swallow, so, nutrition and hydration issues, and suicide. So those are the most common causes of death. Because Huntington's disease causes a progressive loss of function and death, it's important to anticipate care that's going to be needed in the advanced stages of the disease and near the end of life. So early discussions about this type of care enable the person with Huntington's disease to engage in these decisions and to communicate his or her preferences for care. Like, if you are not able to swallow, do you want a feeding tube? Do you want artificial food and fluids?
No.
So creating these legal... Well, we weren't going to give them to anyway, Charlie. Right. So creating legal documents that define end-of-life care can be beneficial to everyone. They empower the person with the disease, and they help family members avoid conflict late in the disease progression. Things that need to be addressed is, do you want to go to a nursing home? Do you want hospice care? Developing a living will, developing your advance directives so that you can identify who's going to make decisions on your behalf. So these things, just as in a diagnosis of Alzheimer's disease, it's a progressive disease and it's not going to stop. We don't have any way to treat these kinds of diseases. And so knowing that and acknowledging that, you can see why people maybe want to know. It's like, I'm going to pretend that none of this is going to happen. And there are people who choose to do that. But knowing what's going to occur allows you to make plans, do an advance directive that addresses what is it that you want to have happen.
Yeah, exactly. That said, there's no cure, but, as we, often discuss, prepare. What kind of death do you want? Yes.
Knowledge is power. Knowledge is power.
Yes, it is.
And so on our webpage, I'm giving Sandy a resource list, some things for you to consider and continue to learn about Huntington's disease. And it's a difficult disease. It doesn't happen that often, but if that runs through your family, then it's something that you never know when you're going to have to deal with it. So in our third half, this week, like I said, I had the pleasure of interviewing Michael Porter for our radio show on Passionate World Talk Radio. So his wife, Janet, has Huntington's disease. She was diagnosed 12 years ago. And he writes a blog that you can read at reachingout.love. So it's reachingout.love. Charlie's going to read one entry, with Michael gave us permission, that was written 11 years ago, right after Janet's diagnosis. Charles?
The first time I really began to understand what HD meant in concrete terms was shortly before we moved from Ohio to Texas and our son came for a visit. He and I were out together one day doing some shopping, and I took the opportunity to explain to him some of the troubling behaviors that I had noticed were developing in his mother. So I cautiously explained all the things that I had observed, being very careful to include only situations that I could easily justify to him. I was so careful because I was sure that his reaction would be, "Oh no, Dad, you must be wrong, not Mom." Instead, what I got was a shrug and, "Yeah, but Ma has always been like that." As we continued talking, it became clear that my college-age son had a much better insight into what was going on than I did. He explained to me that when I was away for work, she would make nice while I was home on the weekends, only to let loose again when I went back to work. It was clear that my son's memories went back a lot further than her diagnosis. Eventually, I had the opportunity to listen to webinars on the HDSA website that talked about the progression of the disease before the patient is diagnosed. One of the things that researchers had begun recognizing was that while the physical symptoms were typically what drove the patient to go see a doctor, the emotional and cognitive problems could start much earlier, often decades earlier. The most immediate result of this information was the realization that it was possible, indeed likely, that our two children had never known their mother when she was not exhibiting the effects of HD. That was shocking enough, but as a result of my recent inquiries into what I had lost, I came to suspect that the same might be true for me as well. Perhaps on our wedding day, Huntington's disease was already in the picture, already playing a role. Goodness knows, in hindsight, there were warning signs aplenty. A friend that has known Janet for years once told me, for as long as she has known Janet, there were times when she could be difficult due to her temper. Then there was the fact that Janet never liked holding hands while we walked. She said that it threw her off balance. I always took that explanation to mean that she just didn't like holding hands, but now I'm wondering whether HD had already started degrading her balance, just a bit. So if I circle back to my original question, what have I lost? And I discovered that the loss might not be so ambiguous after all. One of the things that I have clearly lost was a fairy tale past where everything was okay before the disease. I realized I made a lot of excuses for her over the years, such as the time when I explained to the cop living next door to us in Ohio that I had a black eye because I walked into a door in the night. He just stared at me with a look on his face that said, "Do you have any idea how many times I have been told that crap?" But all he said was, "Are you sure that's what happened?" Looking back, it's very likely that the Janet I miss, the real Janet that I have talked about so often, never really existed. Not at all, except in my hopes and dreams. The real Janet was a person that she would have been had she had been able to free herself from the baggage of her father's abuse. That was the battle I was prepared for and was more than willing to fight. Unfortunately, that was not the battle I got. Just as she inherited the HD gene from her dad, she also inherited the anger. However, that inheritance did not come about through the action of a DNA molecule or even a probate court. Rather, it was passed on through an endless series of assaults, such as being slapped across the face multiple times because she didn't know what page of a missal a particular prayer was on, or being verbally derided for not knowing what country produced cinnamon. And if that load wasn't enough, when the HD began to manifest itself, she got new anger of her own. Anger about a world out of control, anger about failed expectations and unfulfilled promises. Every day now, anger piles on top of anger to create an unstable emotional tower that is doomed to fail when it can no longer support its own weight. So where exactly does that leave me? What I've lost is a fairy tale. What I've gained is a large dose of castor oil flavored reality. The smart money would probably tell me to cut my losses and get out before it gets worse. The only problem with that advice is that I have never been particularly smart in that way. In point of fact, I still believe in such quaint and corny ideas as integrity and keeping your promises, even when the original thing left of the original relationship is the promise. Consequently, I will for now let husband fall to the side and find fulfillment in my new position as male nurse. So should I consider that move a demotion? No, not really. You see, my core desire has always been to give Janet what she needs, and she doesn't really need a husband right now. What she needs is a really good nurse.
What'd you think of his blog?
This is terrific. Yeah.
Doesn't that kind of get the point across?
Perfectly. Yeah. And I like at the end that he's not, that he just sees his role as not so much as husband, but, she needs someone to take care of her.
You should listen to his the interview, because he talks about how he takes the role of husband and puts it in a box and puts it on the top shelf of the closet. Mm-hmm. And he is just her caregiver. So when she's abusive or whatever, he's just her caregiver. And when she says, I wish I never married you, or, all these things that she says, she's not talking to him as a husband. She's talking to him as a caregiver. And I'd asked him about, well, do you ever take that box down? And he talks about taking it down and crying. You should listen to that. I mean, it's a good interview. He's a very articulate man.
And ladies and gentlemen, thank you for listening. Please stay tuned for future episodes of Everyone Dies. Our thanks to our executive producer, retired Major General David, our producer Sandy, John, our technical advisor, Molly, our Twitter correspondent, and our friends, family, and our loyal listeners who are supporting our work at Everyone Dies. This is Charlie Navarrete.
And I'm Marianne Matzo, and we look forward to talking with you soon. Remember, every day is a gift.
This podcast does not provide medical advice.
Synonym.
All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.